Let's turn now to Dr. Frank McGeorge to get some insight on these therapeutic treatments.
And these aren't really new. They've actually been in use for a while now.
Yeah, absolutely, Kim and Devin. The monoclonal antibody treatments are not new at all. In fact, here's the thing. As coronavirus cases have increased in this wave, we really want to optimize treatment. And we believe there are many people who are eligible for monoclonal antibody treatments who either aren't being offered it or don't know to ask about it. Now, the most ideal candidates to receive these treatments are people testing positive for COVID-19 who are early in their course and have certain risk factors like obesity, diabetes, age over 65, or a combination of risk factors if they are younger than 65. Now, I should also point out, this is only indicated for people who do not need admission to the hospital. And unfortunately, that's honestly why it's not being used as often. Someone who might qualify but had a COVID test at, say, a freestanding facility and didn't choose to see their doctor, they just wouldn't know that this treatment is available or to ask for it.
Doc, we've also been following these latest developments involving the Johnson & Johnson vaccine, which has been put on a kind of pause. So let's talk about what's happening there.
Yeah, well, the CDC's Advisory Committee on Immunization Practices has been meeting for several hours to go over the details of the 6 known cases of these rare blood clots. Now, all of the cases were in women between the age of 18 and 48, and because clotting disorders can be more common in women on birth control or who might have recently been pregnant, they did say that only one of them was on hormonal treatment and none of the cases were related to pregnancy. In fact, based on the data calculation by the CDC, the number of these cases was higher than the number that might have been expected as simply background, raising the possibility that there could be a relationship to the vaccine. Now, right now, the decision that the committee is currently considering is whether to leave the emergency use authorization as it is, perhaps recommend that its use be limited to adults 50 or older, or perhaps only men, or they might recommend that the vaccine authorization simply continue to be paused while more data is collected. Unfortunately, they just haven't voted yet, and as soon as they do vote, we'll give you their decision. Back to you.
All right, Frank.